Am I right? Hello, good afternoon. This is live, right? Hello, good afternoon, everybody. This is Dr. Vivek Singh here. I'm working as a consultant gastroenterologist at SL Raheja Hospital, Mahim. So today we have taken up a simple topic, diarrhea, which is very common disorder. On and off, everybody gets an episode of diarrhea in every 2 month, 3 month interval, right? So we thought we will try and cover something very common, which is of public interest since this is a community awareness program. So we thought we'll take up some topic which increases awareness and it has to be a fairly common problem, right? That's why we have taken up this topic. So coming to what is diarrhea? Diarrhea is water liquid is stool. Okay, that is the basic definition in a layman's language. That is what is diarrhea is. If you try and go more scientific, so how do we define diarrhea? So whether it is only the consistency of stool, whether it is the frequency of stool, or whether it is the volume or the weight of stool. So all these three components has some weightage, right? So if there is a baseline, like we first will discuss about the frequency of stool. If the baseline frequency, it varies from person to person in different age group, it will be different, right? So depending on the frequency, some people will have a baseline frequency of passing stool once every alternate day. Two people will come across people who have a frequency of 3 to 4 times in a day, but that is considered to be their baseline frequency, and this is how it has been for years together without any significant weight loss, loss of appetite, good appetite they are maintaining, and they are functioning well, right? So this is considered to be their normal frequency. So when do we define diarrhea? So any recent change in the frequency of stool, like if the patient was passing stool 2 times in a day or 3 times in a day, and suddenly it becomes 5 times in a day. So that is how we define diarrhea. So any recent change in the frequency of stool, any frequency more than 4 or 5 times becomes very significant. Up to 2 to 3, the baseline frequency of 2 to 3, we can consider it to be normal. Okay. Second component of the diarrhea will be the consistency of the stool. So different people, for even for an individual, they will have a varied consistency across, right? For in 1 week, if you ask a person whether he has been passing daily hard stool or liquid stool or soft stool, so it will not be like that, right? So every time you eat different kind of food, the consistency might change. So the moment the consistency becomes more towards liquidy side, watery side, so we call it as diarrhea. So, are there any specific guidelines or criteria to say, okay, this consistency is supposed to be diarrhea and this consistency is not supposed to be diarrhea? Okay. So, in Indian population, since we are considered to be population as a population, we are considered to consume more dietary fibers in our diet, right? So, our frequency, our consistency is supposed to be more on the liquid side. So, there is a scoring system. There is a scale called as Bristol stool scale. Okay, in this we will grade the stool consistency from very hard to watery from 1 to 7. So a consistency of 6 to 7, if the patient has a consistency of 6 to 7 on Bristol stool chart, it is considered to be diarrhea. The third component is weight or volume of stool. So different, like the moment the weight increases, the weight of the stool in even in a population who consume high dietary fiber, if the weight increases beyond 300 grams, it is considered to be diarrhea. So see, this is not an exact way, and not in clinical routine practice we ask the patient what is the weight of your stool. So we basically more rely on the consistency and frequency rather than the weight of the stool. So weight of the stool will be considered in some experimental studies, okay, in labs. But for clinical practical purposes, it is always the consistency and frequency. So this is how we define diarrhea, right? So what are the types of diarrhea? So types of diarrhea we will divide into two. First is small bowel type of diarrhea and large intestine type of diarrhea. Okay, and second, depending upon how long the diarrhea has been present. So we'll call it as like acute diarrhea, persistent diarrhea, or a chronic diarrhea. I'm really sorry. Just- Sorry. So first we'll go about the type of diarrhea, whether it is small intestinal diarrhea or large intestinal diarrhea. So any diarrhea which is arising from the small intestine, like infective viral infection or bacterial enteritis, in this patient we will have large volume diarrhea, large volume watery diarrhea, the frequency might not be very high. It will be high. It will be like 5, 6 times, but it will never reach like 20 times, 15 times. It won't reach. Okay, so generally the frequency will be high, but not very high. The volume of diarrhea will be voluminous watery diarrhea. Okay, and the pain will be in the center of the stomach, somewhere around the umbilicus. That is how a small bowel diarrhea is, as compared to a large bowel diarrhea or infective colitis, if you say. So this is mainly caused by amoebic infection or bacterial colitis. So in this patient, the frequency will be higher as compared to the small bowel type of diarrhea, and the amount of stool that we are passing might be less. So this type of large bowel diarrhea will have small quantity, more frequent stool, and the stool might not be completely watery, it might be more of semi-solid. A lot of these patients with large bowel diarrhea will also have mucoid stool or stickiness in the stool, plus or minus depending upon whether it is an infective colitis by an invasive organism. It will also, they can also have blood in the stool. So these are the main two types of diarrhea: the small intestinal diarrhea and the large intestinal diarrhea. Then coming to the another classification on the temporal basis, like how long the diarrhea has been there. Depending upon that, so there are some questions I think in live. We will discuss the questions at the end. Okay. So depending upon the duration of the illness, so most commonly what we see in society, more than 90-95% of the cases are acute diarrhea. Okay, so how do we define acute diarrhea? Any diarrhea which is lasting for less than 14 days is considered to be acute diarrhea. Then there is a thing called as persistent diarrhea. So an interval between 2 to 4 weeks is considered to be a persistent diarrhea. So a diarrhea lasting for more than 2 weeks, but not beyond 1 month. Whereas a chronic diarrhea is any diarrhea lasting for more than a month. We classify it as chronic diarrhea. So most see the, as this is a community awareness program, the what type of diarrhea what we commonly see in community is a small bowel type of diarrhea, is a acute type of diarrhea. So these acute diarrheas will generally be self-limiting. Will most likely, most of the cases of diarrhea that we see are viral diarrheas. Okay, and sometimes occasionally we can have bacterial diarrhea, bacterial acute diarrhea. So all these will be, even the bacterial illness will be short limiting, self-limiting, and the duration will rarely be beyond 7 days. And it will be like self-healing process. The diarrhea will be there 24, 48, 72 hours, and then it will go away automatically. And in the meanwhile, the objective is to keep you hydrated. So as to not develop any complication of the diarrhea. That is what the objective is in most of these acute diarrhea cases. Other than this infective diarrhea, what other type of acute diarrhea that we can get is food poisoning related diarrhea, in which the organism per se is not the cause of diarrhea, but the product, the toxin that is secreted by the organism. The moment we consume that toxin, it leads to profuse large volume watery diarrheas. So this is toxin mediated diarrhea. And the third will be food allergy type of diarrhea. So you will hear people saying that, okay, I have eaten this food, and after this food, every time I eat this kind of food, I get diarrhea. So a food allergy type of diarrhea. Okay, all these diarrheas, acute diarrhea, will generally be self-limiting, not lasting beyond 2 to 3 days. Okay, so a diarrhea which is lasting beyond 7 days, but not beyond 14 days. So 7 to 14 days. So these are mostly protozoal diarrhea. Protozoal as in amoeba-related diarrhea or protozoal infection. These will be lasting for more than 7 days. But again, these will also be self-limited. If not, just a simple course of antibiotic will cure these diarrheas. Okay. What will be the presentation in most of these cases? They will generally present with watery diarrhea, sudden onset watery diarrhea after some eating some food, outside food, or drinking some unhygienic water. So they will start complaining of loose stool, watery stool, frequency of stool, loose stool, abdomen pain, depending upon what type of organism is harboring, what kind of infection you are getting. You might have vomiting also. Most of the viral diarrheas, they will have vomiting as a component of the diarrhea. Other than this, there can be features of dehydration. That is one thing that we are worried about. So how do we know we have dehydration? So there will be some red flag signs. Red flag sign will be in the form of giddiness when we are trying to stand up. So this is evidence of low blood pressure, right? So the moment we get up from a sitting position, we feel lightheadedness, giddiness. means you are dehydrated. Excessive thirst, decreased urine output, decreased frequency of passing urine, all this will be suggestive of dehydration. The patient has become dehydrated because of 2 or 3 days of watery stools. Other than dehydration, what are the other red flags that we are looking for? So, at any point of time, if you feel there is any blood in the stool, any disorientation, the patient has become disoriented during the course of diarrhea. Patient starts getting high grade fever or severe persistent abdominal pain which is not subsiding. These are red flag signs and immediate medical attention should be taken. Okay, you should not sit at home, keep drinking some ORS water and waste time. The moment you feel that any of the red flag signs are there, immediately consult on the nearest hospital, right? So, if you go into detail of the history and you ask the patient, most of the time they will give a history that in last 24 hours or 48 hours they have taken some outside food, some unhygienic food, Chinese food, or even in Chinese food, especially the fried rice. Uh, Good restaurant also they can have sushis and food, partially cooked seafood, which can give toxin related diarrhea, which can lead to toxin related diarrhea. So these are the other reasons in other than this in areas like even immediately after rains, okay, the water gets contaminated and then we see a flood of patients coming in with watery diarrhea. So these are all the common history that we get with the when the patient comes to us with diarrhea. So we have discussed the red flag signs, and now we come to the treatment part of it. So, do we need to come to hospital for every diarrhea episode? Not really. Okay, so we divide this whole discussion of treatment part into two groups. First is what home treatment you can take. Second group is when do you come to the hospital. Okay, so what home treatment you can take. So immediately start drinking as much of water as possible. Small sips continuously, keep taking ORS water. Okay, so you get some electron sachet or something, you put it in a liter of water and keep taking sips of it throughout the day. Okay, you take about 2 to 3 liters of this through the day so that you don't get dehydrated. That is the whole objective, right? Like we already discussed, most of the viral and bacterial diarrheas will be self-limiting. It will take about 24 to 48 hours or at most 7 to 2 hours for the diarrhea to start resolving. But in this 24/7 to 48, 72 hours, we don't want the patient to get dehydrated. We don't want the urine output to drop. We don't want to have complications related to this acute diarrhea. So our main objective is to keep the patient hydrated. So at home, what you can do is keep drinking as much of electron or as much of ORS powder you can drink. Second thing a lot of people do is they stop eating. They feel that the moment they eat, they have to go to the washroom. Okay, that is not a good idea. Okay, body continues to require energy and calorie. So starvation does not help. Rather, it can be more detrimental if you stop eating food. Okay, so irrespective of diarrhea, you have to continue eating. Okay, so there will be some patients who say, okay, the moment I start having diarrhea, I cannot tolerate anything. The moment I take some solid food, I will have vomiting. So in those patients, they can continue to keep hydrated, and continue to take ORS water continuously. The moment you say, okay, I cannot tolerate water also, that is the point where you come to the hospital. You don't waste any more time at home because you're losing water through loose stools and you're not able to replace it either with food or with electrolyte water. Okay, that is the point where you come to the hospital. Second thing is antidiarrheal medication and the role of antibiotics in these acute diarrheas. So antidiarrheal medication like Lomotil or loperamide or some bismuth-based drugs. So you can take these products if you don't have any other features other than diarrhea. If it is a plain simple diarrhea and you're not getting any fever, there is no vomiting, abdomen is not bloated, you can take this medication. But the moment you have fever or you feel there is some blood in stool, all these medications will not help. Okay, ideally in this situation, you just come to the hospital, get admitted, start with IV hydration and IV antibiotics. Okay, second, this is antidiarrheal. Coming to the antibiotics. So most of these diarrhea, these viral diarrheas as well as the bacterial diarrhea, they are self-limiting and usually do not require any antibiotic treatment. So what is the indication? When do we start antibiotics? The moment you get any fever, you start getting crampy abdomen pain, which is continuously there, some blood in stool. Okay, then you start considering that we should start antibiotics. Other condition in which we will start antibiotic is if there is profuse diarrhea. If the patient is passing like 10 times, 20 times the patient is passing loose stools. In that case, we generally don't wait. we ask the patient to get admitted and start with IV antibiotics. So this is how we manage diarrhea. So management is home based. Drink a lot of water, especially ORS based products. Keep eating as much as you can tolerate. Okay, if you feel you are having a lot of nausea sensation and vomiting, you can stop eating. Rely only on the fluid intake. Take antidiarrheals if you feel there is no fever. Antibiotics generally not recommended. The moment there is fever, you should get admitted to the hospital and start with antibiotics. So coming to the consultation part, when do you consult a doctor, a general physician, or a gastroenterologist? So if there are signs of dehydration, like this dry mouth, the urine output has decreased, there is lightheadedness, so then you know that you are dehydrated and you require IV fluids. You need to come to the hospital, get admitted, start this. Second thing will be if there is any blood or mucus in the stool. Okay, and the last diarrhea has lasted for more than 5, 6 days, 7 days now. So now, even if you're not dehydrated, you should get admitted to severe abdominal pain. Okay, which is not improving, or if there is presence of loose stool more than 6, 7 times a day, you should get admitted or get a consultation from a doctor, especially a gastroenterologist or a general physician. Okay, what are the preventive measures? Like since we're discussing acute diarrhea, so there are some US FDA food safety standard recommendation. Okay, which guides us like about food safety, because most of these diarrheas are food or unhygienic water related. Okay, so I'll just enumerate a few of the recommendations. So first is milk. They strongly recommend against drinking non-pasteurized milk. So milk, whatever you are consuming, raw milk should not be consumed. Only pasteurized milk. Pasteurized milk also should be refrigerated at home, should not be kept out. Coming to the second part, fruits and salads. Whatever fruits and salads you're taking, you have to wash it thoroughly before consuming it. Third thing is refrigeration. If you're talking about refrigeration of food, whether it is healthy, not healthy, whether you're losing some nutrition by keeping the food in refrigeration, I don't feel so. Okay. So if you keep preparing some food and keeping it in fridge and you can consuming it later, it will not lead to loss of nutrition. Okay, that is a myth. So you can keep your food in your refrigerator and consume it later, provided you're keeping a temperature of less than 4 degrees Celsius in your refrigerator. Okay, if you have kept the food outside, especially in a warm condition, warm environment like in Mumbai right now, if you're keeping the food outside for more than 6 hours, preferably it is not a good idea to consume such kind of food. Okay, coming to meat. So raw meat, fish and poultry should be kept separate from other food in the refrigerator. Every time you are using a knife or a chopping board, you have to wash it after if you are chopping raw meat or fish-based product. And then for cooking, after refrigeration, if you are taking out meat or fish-based product, you have to cook it at high temperature for a long period of time. Avoid eating raw meat. Okay, so this is all about acute diarrhea that I wanted to discuss. I'll just enumerate few causes of chronic diarrhea. Okay, so if you are having persistent chronic loose stool lasting for more than a month, which may or may not be associated with weight loss, loss of appetite, abdomen pain, fever, may or may not be. But any kind of chronic diarrhea should be evaluated extensively. We need to find the reason, okay, because these can be more dangerous. So, what are the common type of chronic diarrheas which we come across? So, either it can be inflammatory diarrhea. Inflammatory diarrhea will be in the form of inflammatory bowel disease, infective causes like tuberculosis, and neoplastic causes. So these will be our inflammatory causes of chronic diarrhea. Then we have fatty diarrhea, which can be because of maldigestion or malabsorption. So there is some disorder with the mucosa of the small intestine because of which the food is not getting absorbed. Or there is some problem with the digestive enzyme. The pancreas or the liver is not producing enough enzyme to digest the food. So these are the this will lead to fatty diarrhea. So inflammatory diarrhea, fatty diarrhea, and the third type will be drug-induced diarrhea. And the rare common uncommon disorder will be endocrinological disorders like carcinoid syndrome, gastrinomas, VIPomas. They can lead to large watery type of diarrhea, which will be persistent and will last for a long period of time. So all these needs extensive evaluation, generally in a proper hospital-based setup. Thank you for your time.